This morning, we may not think, in fact, I think most of us don't think about allergies affecting us at this time of year, but there is definitely something in the air that many of us are feeling. So to the rescue, our health and wellness reporter, Sonia Azad, with more on this, Sonia.
Well, I hope so, you guys. This is the time when cedar really makes its big debut. So I'm doing this because I noticed a lot of people complaining about allergies on Facebook, even in our newsroom. Yes, can you believe that? Well, I called in an allergist for advice on how to approach the next several weeks.
So what's in the air that's irritating everyone right now? Cedar.
Cedar is coming on. It's the worst pollen season really of the calendar year. Typically this time of year, just starting at the beginning of December, they'll start to notice itchy, watery eyes, scratchy throat, stuffy, runny nose.
How do we know if it's allergies or a cold? Think itch versus fever.
If you have fever, you have an infection. If you're having itch, itchy eyes, itchy nose, itchy throat, it's more likely to be allergy.
Is this cold snap going to help? Well, sorta. It depends on your sensitivity.
The cold weather actually is a trigger for the cedar tree to pollinate. So the cold air may help to do away with the ragweed pollen, but it ushers in the cedar pollen.
What's the best treatment for allergies?
An immunotherapy can be both in the form of a shot or sublingual. Insurance typically covers the shots, not the sublingual drop.
And when he says sublingual, you guys, it's the drop. So it's important, though, to take care of your allergies, and here's why. If you don't treat them, they can morph into congestion, upper respiratory issues. All that mucus gets trapped, and what do you have? Yeah, an overgrowth of bacteria, which leads to sinus infections. And Alexa, doctors are treating a lot of secondary infections right now, and that all boils down really to not treating allergies.
You know what? And sometimes it's right there in front of us. And it's not simple, as you say, but it just simply is allergies, and a lot of us will try to look farther into it and maybe diagnose ourselves incorrectly.
Well, and if you have questions, Mike Calvin is here right now, standing over there. We're going to go sit down at the computer and just get on WFAA's Facebook page. You can ask us questions. You can ask him questions. I'll just type.
All right, so get your questions ready.